Female genital mutilation comprises all procedures that involve partial or total removal of the external female genitalia or other injury to the female genital organs for non-medical reasons. The practice has no health benefits for girls and causes severe bleeding and problems urinating and later cysts, infections, as well as complications in childbirth and increased risk of newborn deaths. It is nearly always carried out by traditional practitioners on minors and is a violation of the rights of children. In several settings, there is evidence suggesting greater involvement of healthcare providers in performing female genital mutilation due to the belief that the procedure is safer when medicalized. According to a WHO report, more than 200 million girls and women alive today have mutilation in 30 countries in Africa, the Middle East, and Asia, where female genital mutilation is practiced. What are the dangers of female genital mutilation? These and others will be discussing on your regular health TV talk show, The Physicians. It's another great day with The Physicians, where your health is our business. Today we'll be talking about female genital mutilation, the dangers. My name is Dr. Martina Agbere, your regular anchor on this program. And with me, as usual, is Dr.
Memuna Yusuf Kadri, and welcome to your favorite health TV talk show, The Physicians, where your health is our business.
So you know what is happening? While we were growing up, okay, in our community, it was like a thing of the pride, a thing of joy.
But did you do it in your community?
Yes, in my community, they used to do it.
Oh, really?
Yeah.
Okay.
It was like a thing of pride, a thing of joy, especially for the mothers.
Okay.
When you have to do circumcision for the females. Okay? And some girls actually still look forward to it. Because you know what happens at that time? When a girl is circumcised, they usually will buy a lot of things like gifts.
Oh,
clothes,
so it's a gift
wrappers.
yeah.
Then as a bride, you don't do any house chores. You sit at home for the duration of time for the wound to heal. And at that time, anything you ask for, food-wise, the traditional food, with big fish, they will give to you.
So it's the food?
No, imagine. So that was actually what was happening. But of course, a lot of people, for instance, myself, I was like, no way. My younger sister, one of them said, she must have it. She said it must, because she looked at everything the paper was going to gain. But as God would have it, a lot, my elder sister, all of them, everybody said, we've heard about this thing. You people should not agree. Don't agree. Nobody should agree.
Let people get educated and be enlightened about the health consequences.
Okay, let people get educated and be enlightened about it. We'll be back after the short break. Stay tuned.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you have just joined us, you're on to your regular health TV talk show, The Physicians, where your health is our business. Our topic today, we're going to be discussing dangers of female genital mutilation. In the studio with me, we have our guest. She is also a member of the Medical Women Association. She is a senior registrar with the Obstetrics and Gynecology Unit, and currently the president of the Association of Resident Doctors at the Federal Medical Center, Ebute Mesa. She is Dr. Onyinye Lassin. hope I
You're
pronounced it very well.
welcome, Ducky.
Yes, you did. It's quite rare to get someone pronounce it that easily.
Last
the first
right.
time.
Thank
They will have
you.
said last song or something like that in their own intonation.
Some people even say Lawson.
They will remove the R and replace with
replace
W. I can
So
imagine.
welcome. Welcome. Nice seeing you. M1
Nice
Medical
to
Women
hear.
Association. You are currently treasurer, right?
Yes.
I am
Just
also
keeping
the
that bunny
president of the Association of Resident Doctors, okay?
Exactly.
Well done, well done, well done. Now, we're going to be talking about the dangers of female genital mutilation. Do you want to first tell us something around this, just a general overview? Female genital, I know there are different types, okay? But just break it down to where people can understand what it really means when we talk about female genital mutilation. Now we're using that word. In those days, they'll say circumcision.
Exactly.
But now, we don't call this circumcision anymore. We say it is female genital mutilation.
And that is to drive home and emphasize the barbaric act that happens.
Very barbaric.
Because when you say circumcision, people get confused. They think it's equivalent to male circumcision,
Okay.
which is for health reasons. But for females, there is no health benefit at all with female genital mutilation. Like you rightly said, it involves cutting a part or even all of the female external genitalia. That is when you look at a woman, the things that you can see
As a woman.
as a woman.
None is that.
All right. So there are many types, like you said. We have type 1, which is what is called clitoridectomy. The clitoris, that's what is equivalent to a penis in males,
Okay.
is actually cut off. You know, just like for males, you know that it's the covering, the hood that is removed.
Yeah.
So for this type, for some people, they remove the hood of the clitoris, while some all go as far as removing the whole clitoris. And we know that that's a highly vascularized
Area.
and highly nerve
Sensitive,
supplied
area.
area. So that's type 1. Type 2 has to do with either type 1, where part or all of the clitoris is removed, as well as part of the labia minora, plus or minus the majora. So you can imagine. I'm wondering, which is what should even excite the woman and make the whole process more exciting for both partners. And apart from that, they also say, okay, as a rite of passage, if it's not done, they are ostracized, they are not a rite of
From the
passage from
community.
childhood to adulthood. And that, you know, all these myths that surround this practice is what makes the drivers of this practice, like, oh, the mother is like, oh, some mothers say, oh, I don't want it, I don't enjoy it, I didn't enjoy it when it happened to me. But the fear of, oh, my child will be ostracized, she will not have someone to marry her,
No, they don't
and
have
all
voice.
those things.
Because they don't have a voice.
The voice.
The thing is that there is no health benefits, which we have confidently known, and which the general public, because there's a lot of movement, the people are talking, places where this culture is practiced, they are coming out to say this is what it is. We now know no health benefits. It's more of harm. What are the immediate,
And the long
short time and long time consequences of this practice?
All right. We all know that that area is a highly vascularized area, has a lot of blood vessels, has a lot of nerve endings. So immediate complications, bleeding. Some people that undergo it actually bleed to death.
You're right.
Pain, just like it's for pleasure. You
Don't
can
under-
imagine
without anesthesia.
without anesthesia, no
They
form
won't
of
tie your
pain
hand and your
relief.
leg, 'cause
You are
you'll be
held, you are held bound. You are screaming. You are struggling.
I think they do that so that they will drive home the point, the
Now
reason
what
why
now?
they're doing it, so that you don't even think of going outside after this.
Just like as a psychiatrist, it kills you.
Exactly.
That
Psychologically,
is that
you
is
are
an
gone.
advanced childhood experience that will leave you traumatized for the rest of your life.
Some women, even further down the line, they find they are very averse to participating in sexual intercourse because they, in their mind's eye, they equate the pain with the pain that they went through when they were circumcised, when they had their genitals mutilated. And apart from that, infections. What instruments are used? Razors, scalpels, pieces of glass. Some of these are instruments that have been used from time immemorial.
They will use knife.
Why are
No
you
form
saying
of
it like that now?
sterilization.
It's giving me.
And
I don't
apart
know.
from even the unsterilized instruments, the unhygienic environments where these things are carried out, post the procedure, well, if you will permit me to call it that, the mixtures and all that are rubbed on these things to hasten healing, in quotes. Some sand, cow dung, all manner of herbs and leaves.
And that can lead to tuber blockage, infertility.
You tell me. Yes, of course.
God.
Long-term complications. Then, of course, we've talked of the fear, genital swelling and all those things immediate. Then long-term complications, urinary problems. Imagine where it's just a pinhole you have to urinate from. They come down with painful urination, frequent urinary tract infections. Then some for like the type 3 that I talked about, where there is actually a stitching. For some, there is nowhere for menstrual blood to actually come out through.
They don't have the menstrual problems.
They have menstrual problems.
Because the flow can't come out.
Menses. The flow can't come out. Vaginal problems, because following this, a lot of things. There's also a type 4 anyway, where it involves just cuts and then inserting a lot of herbs and mixtures inside. And all these things are potential focus for infections. Yeah. And even long-term ascending infections and all. So it's a very, are we talking about the sexual problems that arise from that? Are we talking about scar formations that can occur following that, like keloids, hypertrophic scars and all?
Dr. Inye, please, it's beginning to give some goose pimples. I think you should just hold it there. Let's get to those that keep a date with us always on the physicians. We need to hear from them. What have you to say about this barbaric act? Female genital mutilation, circumcision, a process whereby they cut the female to different levels. Let's hear from you. We're back after a short break.
I will say a little, but not much. Somehow I think it's a good thing. I think it's a good thing because I believe it's something worth doing. And anything worth doing is worth doing well. That's what I think.
Every day and in every way, enjoy that I find support. No matter the role you play, you dream back some image for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.
Welcome back. If you have just joined us, you're on to your regular health TV talk show, The Physicians, where your health is our business. We've been talking about the dangers of female genital mutilation, which, in simple words, circumcision. But we use the word mutilation to drive home the point of the extent to which this actually can go to affect the females. It's mutilation. When you say mutilation, I'm sure you know the meaning of mutilation. And the studio, Dr. Onye Lassin has been talking about it. We've talked about the immediate term complications. So let's talk about the long-term complications. Apart from the urinary problems that you talked about, UTIs, and of course, pain when passing urine. So what are the other long-term complications that you want to tell us about?
All right, long-term complications. Usually they have issues when it comes to childbearing, with childbirth. A lot of times, these women have to have procedures to sort of reverse what has been done, to open up that space for the baby to come out. Increased risk of having cesarean sections as a result of that. And apart from that, we all know that sometimes with childbirth, we have cuts, which are called episiotomies. So it's like a cut after a cut after a cut. A lot. And then even some of these can have effects even on their babies. We've talked of the infections that can occur, leading to subsequent infertility, problems with getting pregnant in the long run. And we all know the premium that is placed with childbearing in our societies. So the horrors are endless for these women. Are we not even leaving outside the psychological trauma that they go through? The post-traumatic stress disorder that they experience is real. You see these women, they're so averse. Once you're coming to examine them, they already think that
something like that. The picture just
takes them back to that time.
It's terrible.
So
I'm sure they will not be happy. They will just be so...
No, they can't even, some of them can't even express themselves. It will be maybe when they come in, maybe for going through PTSD or anxiety or a depressive episode, and then you are doing their history, then you can then pin where the problem actually is coming from.
So what I'm actually thinking is this, because there's this adage that says, what you don't know
will don't kill you.
Kill
but
you
know now that it's wrong.
Yes, it's wrong. So where am I going to? Maybe, because most times when they do this circumcision, they're probably still virgin and young. So their first time of experiencing intimacy when they're married. Because they won't know the difference between when you are not circumcised and when you are circumcised. So they're just going to be hit with the complications.
You know, I think at this point, right, with our guest in the studio and being very knowledgeable in this, we've seen and we know, and being scientists, being researchers and clinicians, that this is a barbaric, it must be stopped. What policy do we have against this? And is this policy being implemented and executed? Because we know we are a country where we have beautiful policies, but implementation and execution is always the problem. So what do we have on ground?
Okay, thank you. Internationally, you know, there are a lot of agencies, UNICEF, WHO, World Health Assembly have lent their voices towards stopping this act. All right, even in Nigeria, in May 2015, the then president, Goodluck Ebele Jonathan, signed into law a law prohibiting the act. But of course, we know that this is an act that is shrouded in secrecy, controversy, and culture.
Anything that has to do with culture.
Most of the drivers are even survivors in quotes themselves.
And that's the worst part of it.
That's the worst part of it. And that's what is really driving this thing underground. But I think all we can do is to keep raising the awareness. I like the theme for this year's celebration.
Yes, exactly.
Her voice, her future. Investing in survivor-led movements to stop female genital mutilation. It's time that these survivors take a stand and come out and stand against this barbaric practice.
Because they are survivors, so they should lead their voice.
They've experienced it. They said you never know a pain that you have not experienced or endured. So it's time for these people to speak out. Let them know that they won't, all those myths surrounding are just myths, and there is actually no benefit to this practice.
The truth is, talking about the legislation, okay, during the other president's time,
this is almost 10 years now.
Yes. And have you heard of anyone prosecuted before?
See, both of us are laughing.
Well,
I don't know.
It's not for us to have the law.
Yes.
But if you are not implementing it, it's as good as dead.
It's as good as dead.
You know, but it's also good for us to know, because our viewers will think it's a Nigerian thing only. Is it only a Nigerian thing?
No.
Where did the origin even start from? And why are we even imbibing it in this our own culture? Because of course it's not only practiced in Nigeria, but it's good for people to even know where this is originating from and why some of culture are doing it and some are not doing it.
Why are we talking about where it's originating from?
Because it's important, because they may think it's only in Nigeria.
It's only in Nigeria.
It's only in Africa.
Even in Asia.
Even in Asia, the Middle East.
It's only a Nigerian thing.
Even in Africa, although in Africa, out of the 200 million that you talked about 2/3 of them are from 4 African countries. Sudan, Egypt, Ethiopia, and our beloved Nigeria.
Our beloved Nigeria.
Yes. So, but no, it's not peculiar to Nigeria. It spreads around other countries as well.
Because I remember one of the documents I read on WHO said it's documented in 92 countries around the world. I'm like, whoa, this is huge. It then means that this is a global voice. It's not a Nigerian thing. So people who don't see it as if it is us, and we are the ones being wicked to ourselves.
That's why it's global now. You know, the WHO report says at least about 200 million people, girls and women alive have done it. And about 30 million African countries.
So what are those steps that we should take? On you sitting, take yourself as a policy maker, sitting in on that table. Now these are the things we need to do. There's already a document that says this is what it is. And we know it has not been properly implemented and executed. Now we're in 2024. What should we be doing now to ensure that that document is properly implemented and executed?
First, we need to raise the awareness
Exactly.
and educate and keep advocating. Let's keep speaking out that there is no benefit whatsoever in this. Let's dispel the myths that surround what is driving this practice. And of course, you can, if you have a law that is not being implemented, if you have a law where there is no consequence for breaking such laws, it just remains a law on paper. So it's time for us to put consequences to this and ensure that people who participate in such things, who either directly or indirectly drive such practices, are prosecuted for it.
So you know what I want to say? This kind of a thing, because it's more of culture, I would rather, they're not executing, they're not implementing the laws, because you never can know how it came about, okay? You must have community involvement.
Very well.
So you have the traditional rulers in the community, the town hall meeting, the traditional birth attendants, all of them, all stakeholders must be involved. So when you drive the process from the community, it gets better. They know that you can't come and meet me as a midwife to come and do this.
Exactly.
But the people that are doing it are within the community.
Within the community.
So you can't hide. You can't even hide, because after doing it, the girl cannot walk normal. She must walk.
The screams alone can be heard from kilometers away.
And so, if you hear it, report. So it will be something they will be doing in secrecy.
I think that is what we do. So yes, we now have laws backing it up. So, but you still have to go back to the grassroots, to the community. Get all the traditional rulers, get the community birth attendants, get everybody involved. So that it must continue to ring a bell, let's continue to spread the news. So that way, if they know that somebody has done this and the person is charged, somebody else will know, oh, so they're really serious about this. I think that's the best way to go.
What are our last words to our viewers with regards to female genital mutilation? What should they take away from you today?
Female genital mutilation is a serious violation of human rights. It is something that should be totally removed from our communities. Girls don't need to go through that torture. And torture is both mental, physical, psychological. The effects and there is no benefit whatsoever. So all hands have to be on deck to put an end to this practice.
Thank you very much, Dr. Onyelasin. We really appreciate your coming. And thanks to M1 Medical Women Association of Nigeria, Lagos State Branch, for releasing you to come and talk on this particular topic that has to do with the women. And to our viewers out there, you've heard it from our guests here. Female genital mutilation is a no-no. If you see people doing it, please cry out. Be your neighbor's keeper. Save that girl. Save her future. Save her life, because what she's going through, you can't understand it. Please support the voices that are saying enough of female genital mutilation. Though the laws are there, please let us try as much as possible to implement them. It's not just enacting laws, it's not just bringing, like we have it on paper, but you're not implementing it. It's as good as gone, it's dead. So let us implement these laws. When we do that and we are able to hold the culprits, then we'll move it forward. On that note, I just want to say thank you for being part of our program. It's been nice having you, and ensure that next week you keep a date with the physicians as usual. My name is Dr. Martina Agberian. Stay blessed.
Thank you very much, Dr. Onye, our very delectable treasurer in Medical Women Association of Nigeria. It was very nice having you on ground. To all our viewers out there, I'm sure if you know me in this program, My voice is a bit low because I just even feel traumatized listening about this again and knowing that this barbaric act is still being perpetrated. So are you from that community where this is still being done? If you are not talking about it, you are not reporting the people doing it, you are a part of our problem in this society. And it is very important for you to hear and know that there are never health benefits to this barbaric act. Rather, it's harm, it's traumatizing, and some of these survivors live with the trauma for the rest of their lives. So please walk the talk and be an advocate when it comes to female genital mutilation. It's not equivalent to the male circumcision. It is a barbaric act and it must stop. It has to stop now. Please be kind to follow us on all our various social media platforms. And if you want to be a part of this show, you are just a click away. Go to our website, fill the form, and you'll be right there just the way we have Dr. Onyi. And if you have any information that you don't have clarity about, our YouTube page is there for you to get the right information from the right people and authentic people. On that note, I am Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.